Assalamu alaikum. Inshallah, we'll be starting in a few minutes, so everyone who will be attending, please come to the front. The sisters' doors is open, so please feel free to come in. Again, this program is going to be about a health insurance seminar, specifically Obamacare. We'll have a mic set up there, so whenever Brother Abdul is ready, people can come up there, inshallah, and then we can go ahead from there with the Q&A. With that, inshallah, we'll start in a few minutes, inshallah.
Shall we start? Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdul Hafiz Khatri, and I've been doing this health insurance business for the last 32 years, since 1990. And alhamdulillah, I have some knowledge that I thought I should share with the ISGH, with the Muslim community out here and elsewhere in the Houston area. And I just did a seminar. I was invited by Clear Lake Islamic Center about 3 weeks ago. They have started a new program, so I was very close to one of the organizers over there. He said, Brother Khatri, can you come and help us? So I said, okay. So I did that, and then from that, at that point, I realized that this is such an important topic, that information that is available, it's information that's out there, but everybody doesn't know all the answers. In fact, we had a seminar here last year by another member of ISGH, and people had attended that seminar, and there was still some lingering questions that could not be answered at that seminar. So inshallah, I will not have all the answers to your questions, but hopefully everything will be covered, and you should, when you leave here, you should feel good about what you have learned. I've been a member of ISGH for the longest time. I've been a citizen of Houston for more than 40 years. So I'm a long-time servant of this community, inshallah. So once again, my name is Abdul Hafiz Khatri, and I'm here to share information that I know of on Obamacare and healthcare. And in the flyer that was distributed on the WhatsApp group, on the Blick events group over here, it had a lot of questions that I had said would be answered. So I'm going to go down the road on those questions, and then at the end of the session, I think the Isha is about 8:40 over here. Kamal, is that correct? Isha is at 8:40? 8 o'clock? Okay. All right, so we have plenty of time, and inshallah we should be able to cover that. And also at the end of my talk, I'll open it up for questions, and I'll try to answer most of them. So what is Obamacare? That was the first question. And people that are not aware of it, that have not participated in this program, this is something that was created back in 2010 during Obama administration. And the purpose of this creation, it's called the Patient Protection and Affordable Care Act. It was signed into law, and then there were some issues, and some Congress members and Senate members opposed to it, took it to the Supreme Court. Supreme Court kind of held the court and went on with an admission of this program to go on the June 28, 2012. So what this does, what this does is it helps people with the low and middle income group that could not afford insurance to be able to protect themselves, get insurance with a subsidy from the government. And the subsidy this year that I have learned, I attended a Center for Medicare and Medicare Services seminar, and they have said that this year the subsidies have been tremendously increased, and their claim is that 4 out of 5 people that try to get into this program will be able to get it at $10 or less per month. Let me repeat that. People that are trying to get into this program, particularly for the year 2023, will be able to get into the program for about $10 or less per month. Now that doesn't mean that your insurance cost is going to be your out-of-pocket cost will be $10, but the rest of the money that goes into the premium of your particular policy will be paid by the government. So once again, this program was created to take care of the preventive services that people were lacking, and also to take care of people that were rejected by the insurance companies because their claims were too high or beyond their benefit limits. So that it took care of that. So we move on and then go into the question of who qualifies for this program. Who qualifies for this program is basically, this was created for low and middle income group. There is something called a federal poverty level. It's a chart that is published by the federal government each year, and it determines who falls under this category of federal poverty. And that chart for participants that want to get into the program, they're going to go to the 2022 poverty guidelines. And according to the new chart that they have published, a single person that had an income of $13,590 and above, $13,590 and above, up to $54,360 will qualify to apply for a subsidy under this Obamacare insurance. Going further, if it's a couple, 2 people in the family, if their income falls between $18,310 and $73,240, they would qualify, once again, to get a subsidy. Even if you don't qualify within these dollar ranges, you can still get into this program, except the fact that you would have to pay for the premium dollars all by yourself because the government will not subsidize it. Who else would qualify? People that have lost their job and they don't have any insurance right now. People that have moved from one place to the other and are in the middle of getting a job, kind of interim level, and you can qualify for this program. And when you get the job, then obviously you inform Obamacare that, you know, I have a job, and they'll cancel that program. There is a misconception out there that Obamacare is the entity that is insuring you, which is a misnomer, because Obamacare is a program put together by the federal government for people with low and middle income, but then the burden of that has been passed on to insurance companies that are willing to participate in the program. Now, these insurance companies have to apply with the Fed and with the state, where they have to present the different programs that they're going to bring about in the marketplace during that year, and the government has to approve those programs. Question had come up about Medicare and Medicaid. There are many folks in this town that are basically bringing their parents to come and live with them from foreign countries, from Syria, Lebanon, Palestine, Pakistan, Bangladesh, or what have you, or even from Europe. So if the parents are older and they have not contributed, they have not worked in this country, and they have not contributed towards Social Security, they will not be able to get Medicaid as is given to people that have worked in this country. And the threshold on that, on qualifying for Medicare, is that you would have worked 10 years in this country, and each year give you a credit for 4 credits, meaning that you need to total 40 credits to qualify for the Medicare. So when you bring in the parents from another country into this here to live with you, they don't qualify for Medicare. Now, they can get Medicare insurance, but the premiums that the Medicare will charge you will be tremendously high. And it will almost be impossible for you to get insured, because they're looking at $1,500, $2,000 per person. So people that do not qualify for Medicare, parents especially, that have come here to live with their children and grandchildren, they can apply for Obamacare. And they will, Obamacare will take you in, will take your application, and for the kids that are younger and the income level is not high enough, they will first try to send the kids to Medicaid or our CHIP program developed by the state. And if the state doesn't take them, then Obamacare will accept them under the parents program. So that's what that is. What do they require for you to qualify for this program? You need to be a citizen, or you should have at least applied for a green card or residency. You should have some sort of proof that you have done that, because they ask for your Social Security number, they ask for how much income you make, they ask for what you do, your profession, so on. There's a lot of questions that they ask you. Once again, the income level that you have needs to be between 100 and 400%. As a matter of fact, in the CMS, which is Center for Medicare and Medicaid Services, that I attended on, I guess, 20th of October, they said that they would extend coverages to people that fall within over 400% as well. So right now, like I said, in the chart, they have for the federal poverty level, the 400% for a couple stops at 73,240. So if you would add another 18,310 to it, that would be 500%. So meaning that they have become very lenient with offering the subsidies to people. And that's the reason they are saying that your premium out of pocket would be very less this time around, which is telling us that 80% of the people would qualify for $10 or less. When can you apply? You apply between the open enrollment period, which is released by the feds, and this year, typically it starts on November 1st each year and goes until December 15th, but this year it's going to go up to January 15th. So if you apply on November 1st for the insurance, your insurance will be applicable, or you're valid to get that insurance benefit effective January 1st, 2023. Between November 1st and December 15th, you'll get your insurances on January 1st, 2023. If you go beyond December 15th until January 15th of next year, then your insurance will be effective on February 1st, 2023. There is something called a special enrollment date for these programs, which is that you're doing a job, you got laid off, right? So you don't have insurance right now. A group plan will offer you a COBRA. You don't want to take that. So you can qualify to get into Obamacare anytime during the year if you qualify under those circumstances. There are like 8 to 10 qualifying events which will put you under special enrollment, and some of them are you lost your job, you moved, you had an addition in your family, you had a deletion in the family, somebody passed away, your income level changed, or you lost your individual policy that you had for reasons not attributable to you. Insurance company canceled you, so on and so forth. The insurance companies that offer this program have to comply with this Affordable Care Act of 2010, meaning that within this program there are several elements that are called enhanced essential health benefits, which in sense are emergency services, hospitalizations, laboratory services, maternity care, mental health and substance abuse treatment, outpatient ambulatory care, pediatric care, prescription drugs, preventive care, rehab and helping basically rehab services, vision and dental care. Vision and dental care, by the way, is not a program offered by Obamacare. You can get it, but you have to pay for it on your own at 100%. There is no subsidy on that. How can you apply for Obamacare? We can go on a website called healthcare.gov, and over there is a bunch of information. You can access all of it. It's pretty cumbersome if you try to do it on your own. There's a lot of questions being asked, a lot of things that you're not sure of, things that you don't know what to say, how to complete it. So if that is the case, then you can also call them, and there is an operator on the other end at the 1-800-318-2596 number, and they will help you, they will walk you through the whole application process. Or you can approach a broker or agent, and they can help you complete your application. There are navigators out there that the government has assigned. They will navigate you through this program. And then there is nonprofit clinics and community outreach programs that have people in there that can guide you through it. So there are many ways that you can apply for this thing. Like I said earlier, insurance companies are authorized by the feds to offer certain programs. Typically, the programs fall under 3 levels, 3 metal levels: bronze, silver, and gold. Gold being the most expensive, silver being the middle of the road, and bronze being with a very high Now, within these programs, within these gold, silver, and bronze programs, there are so many different variations. A company may offer 5 different gold programs, 15 silver programs, and 25 bronze programs. So when I apply for you on the website and I look for the eligibility results that comes at the end when you've completed all parts of the application, it will tell you how many companies are offering this program to you, and typically it's more than 50 to 60 different programs will be offered to you. So now it's up to you to decide which one you want. And if you're not in the business of insurance, and if you're not familiar with how health insurance works in this country, then obviously you're going to need some help. You need to call somebody, you need to get some help from, and the operator on the other end, they don't know what your needs are. But if you approach a broker or an agent, they will be able to tell you, based on your circumstances, what your needs are, where you need to be to move on with this program. This year, they did release a mock list of insurance companies that, well, now it's already effective, so I've already looked at all the newer companies that have come back into the fold. United Healthcare used to offer this when it was first offered in 2010. They have come back into the fold. They have several programs they're offering. Aetna, as you may know or you may not know, joined hands with CVS. So Aetna and CVS, they are offering many programs under Obamacare. Blue Cross Blue Shield has always been there for the last 12 years. They are offering programs. Community Healthcare is a local insurance company that offers these programs. They've been there from the get-go as well, but they have quite a few restrictions, and they can only offer you coverage outside of Harris County and 19 other counties surrounding Houston: Brazoria, Galveston, Collins, and so on and so forth. Fort Bend, obviously. So far, so good. I think I'm going through this pretty quickly, but there's a lot to be covered, and I can share a lot of more information for you, in-depth information, if you like. If we get to the end of the road here, then we'll open it for questions. Once again, what does it cost? The cost will depend on what is your income level. Not just for you, but for the entire household. Typically, you can apply for yourself, for your wife, for your children, and for your parents. Anybody that lives in the household and you are filing your taxes with their names as a dependent can apply for this program. If your kids are past age 21, 22, they're out in the field, they've graduated from school, they have their own job, they got their own insurance, fine. They can get their own insurance, but we still have to insert their information in this application, but they're not going to get coverage from here. We'll exclude them from the coverage. So like I said, anybody that lives in the household has to be on there. You need, when you insert your Social Security number, for example, you're brand new, you don't have a Social Security number, you've applied for it, they can treat that as a special case. Typically, when you put in your Social Security number, your date of birth, name and address, the system by itself goes and checks your background, right? And they tell you if they are approved or not. But if they're not able to get through with your Social Security number, then they will keep the case pending for at least 60 days for you to give them more information so they can verify your presence in this country. Likewise, when you need to tell them what will be your income level, a projected income level for the year 2023, because the insurance is going to be for 2023. So for example, If you're on a W-2 wages, you're an employee with an employer. They give you fixed wages, for example, $40,000 a year. Then if you're expecting a raise, just do a projection of a raise, whatever that may be, 5%, 10%, and insert that number in there. If you're self-employed and your income varies each year, say between $35,000 and $70,000. So you got to take your best guess and put that income in there. Likewise, whoever is on that application, and if they're making any money, it has to be reported. So it's just not that you report a certain income, you have to report an accurate income, because initially when this program started, there were people that were in business for a long time that were making tons of money, and they were reporting 18 and 20,000 of income. But when they filed for their taxes, the government had a way to go to tap into the IRS and see what your real income is, right? So you cannot bluff them. So you have to be cognizant of the fact that whatever number you're putting in there is going to be verified. So for example, if you showed an income of say $30,000 and your true income is $40,000 in the given year, then your $30,000 would have given you, for once again, hypothetically, a subsidy of $500. So now, with your income increased to $40,000, which is $10,000 more than what you put in there on the application, the government will kind of reconcile your taxes for the following year and take some of that premium credit you had back from you. And your CPA accountant will do that. So at the end of the year, Obamacare or the individual companies that you are insured through will send you a form called a 1095A, and it's a 5 or 6 page document. You will get it on your email, and that will tell the accountant or CPA what kind of credit you got during that year, and they have certain formula that they use, which will then reconcile your credit. So for example, if once again take it to the other end where your income has fallen from $30,000 to $25,000, so you were getting a $500 subsidy per month, now they will credit you more. They'll credit you maybe $600. So you're getting a $1,200 credit at the end of the year. So for example, you're expecting a refund of say $2,500. With this extra credit, your refund now will be $3,700. These are all hypothetical numbers, but this is something that is checked, and you cannot pull numbers from the air and put it in there. It has to be more or less accurate for you not to get hit. I mean, if you don't care about that, if you're willing to pay them $10,000 at the end of the year, so be it. They're okay with that as long as they get their money back. So like I said, the subsidy depends on the size of your family, what income level you're at, so on and so forth. So once again, to give you another example, say for a family of 5, which husband and wife, 3 kids, right? Your income needs to be between $32,470 and $129,880. So up to that point, you will get some sort of subsidy. So that's a good income, and even with that good income, you still qualify. So don't shy away. Just go into it and see what you qualify for. And then the programs are so wide that if you can't afford to pay $200 a month, you can choose to buy into a program where you pay only $25 a month. Obviously, it will be an inferior program compared to what you were looking at, but you still have insurance. Now, irrespective of what level of insurance you get, each person on the program is given the health care benefit, is given the annual checkup benefit. So everybody needs to go and do an annual checkup with a given doctor. So you go and do your annual checkup, no questions asked. Even if your deductible is $9,000, this year the highest deductible is $9,100. Even if it's $9,100, this annual checkup you get for free. Nobody's going to question that. So only thing is that if you choose a certain program, say for Blue Cross Blue Shield, then you have to go to doctors and clinics and hospitals that are within the framework of Blue Cross and Blue Shield, within that network. So each company has their own network. People that are used to buying insurance through their jobs typically used to have PPOs, which is Preferred Provider Organization. But in the last 10 years or so, all have kind of given their employees the option, even large corporations, given the employees the option of doing either PPO or an HMO or a point of service. HMO is a health maintenance organization. Difference is, health maintenance organization is a fixed network, and you have to go within that network to get the benefits. If you go outside the network, it's not being paid. Under a PPO program, you have a choice to go outside the network, but what happens there is, if you go outside the network, then your co-insurance benefit, for example, is 80-20. That kind of then trickles down to maybe 60-40 or 70-30, but you have the choice to go outside the network under a PPO. I already talked about all family members can enroll in there as long as your tax returns show them on there. Even if they don't show them, you can, if they question it, you can tell them that my parent just got here, I'm going to include them in the coming year. So you're good with that. Once people, that kids that have, on kids, until the kid has grown to be 26 years old, they could be on they can be on the parents program. The kid living with you can be on the parents program until 26 years old. So for example, if they're filing their own taxes, they can, they have to be included on the application, but excluded from getting the coverage through Obamacare. But they can apply for their own policy individually or through a group. People that have small corporations under a group, this program gives them the facility to reimburse the employee side of the premium for the employers. So I do group insurances too, and I have several groups. Well, right now, probably a couple of groups under Obamacare, but otherwise privately I've got several groups. So they can, if they go through the system, then they can also apply for group coverage, and they will get a credit on their employees' cost of the premium, which is a benefit to the employers. Under preventive care services, I think I read out to you what all is on there, several things, What I had printed out much long time ago, back in 2013, was a list of so many different things. They have special, if somebody goes into a depression, they have that covered. Type 2 diabetes, they have special cases on those. HIV, immunization, they're all covered under this program. Obesity, STI, tobacco use, blood pressure, alcohol misuse, abdominal aortic aneurysm, and so on and so forth. So there's a lot of stuff that comes under preventive services that is covered under these programs. I think I'm going to stop there and see if any questions have popped up so far. Yes, sir.
Say, for example, you're making a report people, can they still get covered under Obamacare?
Absolutely. Yeah, that's what I said. Like there is a FPL chart, Federal Poverty Level chart. Anybody can go and get that, right? And look at that. And depending on how many people are in the family, you can get coverage. I mean, the highest number that I have here for a family of, for example, 5 is 129,880. Even those people qualify.
What if someone's making 150K?
That's fine. If how many people in the family?
Let's say, for example, 5 people.
5 people. Then they may, this year they may qualify because they've increased it from 400% to 500%. So we'll have to go through it and see. But even if you don't, then you can get the insurance, but you'll not get the subsidy.
Okay.
Yeah, yeah.
Right. A little technical question.
Sure.
So somebody got, let's say, early retirement or laid off at the age of 60.
Sure.
They have
Right,
access to the retirement money,
right,
and they have no insurance.
right.
They're 65.
Yeah,
So now they withdraw from their IRA.
right,
to live on.
right.
So are they going to look at, is that the income?
They're going to look at the income, not your assets. Your assets may be $10 million, but if withdrawal, that's your, this is what you're using to sustain yourself. This is what you're using, your retirement or your IRA money. So you're going to report that as an income, right, on your taxes. So that's your income. You're going to use that. They use the AGI. Yes, adjusted gross income. Yeah. So after, for example, somebody like myself, I've got a bunch of expenses. Now, when I have a bunch of expenses, obviously, I'm not going to report what I gross each year. I'm going to report my net income after I pay for all the expenses. Yes, sir.
What is the percentage of subsidy?
What's the purpose?
What percentage?
What percentage? The subsidy depends on your income level, on how many people are in the family, and the system determines that. There isn't, no, there's nothing in black and white that will determine, if you go and ask somebody, if somebody says that your subsidy will be at 40%, no. It could be 100%. I've insured people where they're getting a subsidy of $1,800 a month. And, they're not paying any premium from their pocket. So basically, the government is subsidizing their entire health insurance for the entire family for the whole year. But keep in mind that $1,800 times 12 is what? 21,600, something like that? If you don't hit that level, and or you're getting that because you're showing very low income. And if your income level has changed, which will be determined when you file your taxes, they're going to get some of that money back from you. So if you can't, so you have to be pretty frank about what you can report. There is some adjustments each year for self-employed people like myself, but other than that, shouldn't mess with it. Yeah, they're going to catch you one way or the other. I'm sorry? Everything is covered. Yeah, absolutely. Even the cheapest type of program you have, prescriptions are covered. Yes. Hospitals are covered, doctors are covered, labs are covered, x-rays are covered, MRIs are covered. Everything is covered. It's a full-blown program. There is no limit on how much the insurance company has to spend on you. If they have to spend $1 million, they'll spend $1 million because that limit, the cap that was there before, has been removed.
Another question. When you get a health insurance through Obamacare, but if you go privately to Blue Cross Blue Shield, et cetera, and buy these insurances, because you've done so many insurances, mashallah, you're deep into it, you've probably seen the policies, the limits. And all that.
Sure.
If somebody has an opportunity to buy or get health insurance through Obamacare or privately, is it fair to say that the Obamacare programs will cover more because the insurance companies have kind of been shackled down and
If you go under Obamacare, most insurance companies have to comply with the ACA. So under ACA, all essential health benefits are covered. Now, if you fall outside of the enrollment period, and you go and try to get your own, there's a lot of companies that had been calling when the Obamacare was in jeopardy in 2013, and they were calling, but they were misinforming people that I'll give you this, I'll give you that. Everything is not covered. They have limited coverage. And you shouldn't fall into that, because they're just calling to make a quick buck, all right? And so that doesn't fall under the ACA Act. You have to make sure that your program that you're getting into is a valid ACA program.
Even if you buy it privately.
Even if you buy it privately. And sometimes I've seen it done both ways, where the insurance premium on the exchange is, say, $1,200, and of the exchange it may be $1,300. And there are certain times where I've seen the premiums to be exactly the same. So each company that offers these programs, they can also offer off-exchange programs, meaning if your income level is, say, 150, like you said, then you can still go through this process. You will not get a subsidy. You'll always be under the ACA compliance, but your premium is going to be paid from your pocket. So that's considered off-exchange. When they created this whole thing, there were many states that abided with the compliance of the feds, and there were states like Texas and red states that did not accept the Medicaid under Obamacare. So then you're still under the federal exchange. The federal exchange is not giving you insurance. They are channeling the insurance through these private companies, and they're paying them the subsidy. The subsidy that, for example, my premium is $1,200, and I'm only paying $200 for right now. The $1,000 subsidy is being paid to these insurance companies by the feds, for most part. Yeah.
One off question. With the elections coming up,
Uh-huh.
whether Democrats are going to be in power or, Donald Trump might come back, you have all this conversation.
Yeah.
How safe, if I get coverage now to Obamacare, or if I already have coverage to Obamacare, how safe is that in the next election cycle? Is that something up for grabs, or can we say, hey, it's in law, it's going to be in law for the 5 years,
What
don't have to worry about it?
I heard recently, for the first 5 years or for the first 8 years, this was in practice. This was in play. They kept trying to get this disconnected or discontinued or what have you. Now everybody has given up because the senators and House members themselves are using this program. So at this point in time, I feel it's pretty safe. Yeah. No matter who comes, they've given up on this thing. This is a given. This is helping the community. Insurance companies lost a ton of money initially. That's the reason United Healthcare and some others came out of the exchange. They didn't want to do it anymore. Now they've come back in because now it's become profitable. Yeah.
So I have a question. So
Yeah.
the PCP, if you're part of this network, you need a PCP, and if you need to go to somebody else, you need the authorization, the specialists.
I didn't follow your question.
I said if you're part of this Obamacare, you're restricted to a certain network of doctors.
Every program that is out there, or even if you go get private insurance through your company, you have to follow the doctors and hospitals within that network. You cannot go to your doctor down the street or to your friend doctor. That person has to be on that network.
So let's say you're part of this network, but let's say you're in Austin and you get sick. Can you find a doctor there that will cover you?
When you are going with because I've been in the industry that long, I know that when I sold my policies back in 1992, 93, 94, all insurance companies would cover you all over the nation. Wherever you went, in fact, they even covered you when you were traveling worldwide. Then they've become more and more restrictive, and it depends on the company that you're with. For example, community healthcare, they only cover 20 counties. So if you fall sick, you have fever, or you hurt yourself or what have you, it's not an emergency. They will not cover that. they will cover, any company will cover you anywhere in the contiguous United States if it's an emergency. But if you're going for a regular checkup and care, it will not be covered.
So I just want to make one comment. When I was about 3 years ago, when I got the Obamacare plan, I went to my broker and I told them, "Hey, listen, I want to get coverage by doctors at Methodist for various reasons, right? Because the doctors I wanted to see were at Methodist, etc., for various reasons." So when they gave me plans, they picked up the plans which were covered by Methodist. So now they give me options of just the Methodist, because my wife also sees some doctors at Methodist. So if you do it that way, you tell your broker, "Hey, listen, I want to see, or I have a baby coming, I want to get the baby done at Methodist. So give me only plans and options that will be covered by Methodist." So they'll give that to you.
There are just a couple of companies that cover Methodist right now, just to let you know. Even United Healthcare doesn't cover Methodist. I checked it. I checked all the networks for all the companies. Now, I don't remember everything, but Aetna doesn't cover Methodist. Blue Cross Blue Shield, I think they cover Memorial Hermann and the other hospitals. There is Community for sure covers Methodist. Yeah.
United Healthcare, they weren't part of it, but now I think they're part of the Methodist.
Say that again?
United Healthcare
Uh-huh.
is part of Methodist now.
Part of what?
They weren't part of Methodist.
This is how it works. Insurance companies and the hospitals and doctors, they have a contract signed. And there's a lot of negotiation that go on. Even Memorial Hermann was out of network for Blue Cross Blue Shield for almost a year. Now they've gotten back in. So they have a contract that they sign. And if they've signed the contract, then they're going to be on the network. Something else, something more detailed and technical is, for example, Blue Cross and Blue Shield say they have 50 programs available under this, right? And they have Memorial Hermann, they have St. Luke's, they have HCA, and they have other hospitals, West Point, so on and so forth. But under Memorial Hermann, the doctors, the clinics, and their hospitals, they will only let a certain program get affiliated with Memorial Hermann, because Memorial Hermann has selected only those particular programs that they're comfortable with their payouts, that they will accept. So it's not a given that if Memorial Hermann is being covered with Blue Cross and Blue Shield, that all their programs are covered with Memorial. So that's something else you need to check. And like you said earlier, if you want to go and see a particular doctor or go to a certain hospital and what have you, you can find out, you can talk to your broker, and they can look for you and tell you that this person is, whether this person is on the network, this hospital is on the network or not. And another admission is that if you want your doctor, who is not on the network, you can suggest that for the company to put them in the network. That may take some time. It may happen, it may not happen, but that's another option you can have. But once again, these things, not everybody knows, but, I've been around a little bit, so I can vouch for that. I've gone through all these rigmaroles with different companies and the claims. So I think, inshallah, that's about it. If we don't have any more questions. Yes, sir.
I came in late.
No problem.
Did you talk about the Medicare?
No, I didn't talk about Medicare. I just talked about health insurance under Obamacare. Yeah. That's a totally different subject. Yeah. And there are many restrictions about what you can do under Medicare programs. And even when you do seminars and whatnot, there is certain what you can say, what you cannot say. I'm qualified and I'm certified under Medicare as well, but I'm not here for that.
Yeah, they're bombarded with the.
Yeah, I know. Yeah.
But
You can call me and I can give you suggestions on that. Yeah. Yes, sir.
In my case, I have a question. My mother, she lives in Jersey with
Uh-huh.
Filing her this tax. So I'm planning on her moving here this month.
Okay.
So once she moves here, I'll change her ID address.
Sure.
Will I be, can I add her?
Yeah, absolutely. Yeah. These programs, like I said, the enrollment period is from November 1st until January 15th. You can add her on there and no issues. They will say, they may come back and tell you that she is not on your taxes. You can give them an explanation later on, but that's down the road. For your income verification, if you have not filed your taxes, they will not renew you the next year if they don't have evidence of your filing of taxes. Something else, it's always good to update your application each year because your circumstances may have changed. That way you're safe in terms of, you know, not getting hit with a big chunk of paybacks. So yeah, you're good.
So can I apply for my application and then add her later?
No, not right now.
Okay.
Yeah, right now. Absolutely.
Brother, quick question. He can add his mother even though his mother might not be on his taxes?
She will be on his taxes for the year 2023. Because she, yeah. So this, we are doing projections right now. Yeah. Yeah. I mean, you do the actuals, but then you do the projections as well, which is, you know, an estimation of income. Yeah, and an addition or deletion of family members. Yeah. And you can add, for example, if somebody moves into your family down the road, that's a transfer, right? I believe you can add them on during the interim period too, at that time, but I'm not 100% sure on that.
Who do you recommend actually? Like which company? Because I recently moved there. I don't know much about that.
What you have to, first thing you need to do is go through get the application approved, and then look at what your choices you have, and then let somebody like myself or any other broker give you recommendations on what your need, based on your needs, what should be applicable to you or what you should get, a few choices. Because like I said, you'll get a choice of 60 to 70 different programs and you don't know what to do. I mean, you can select how much premium you want to pay, and based on the premium, they can shortlist the companies and then share those companies with you.
I just want to make a quick comment on your comment. When I was looking for programs 2 years ago, Community Health Choice was covering Methodist in the silver program, but not in the gold program. Even though the gold program was more expensive. And I asked my broker, hey, why is Community Choice giving me silver in Methodist but not gold? He said, you know what? They change the program every year, and this year they're offering you this. So if you want the Methodist hospital doctor, go with the silver.
Not necessarily true. That applied to you 3 years ago. They may have changed it again. So anytime when you're selecting a certain program, at that very time, your broker or agent can verify for you if that particular hospital or doctor is in the network or not. We can look at the network right away. So, you know, what is true 3 years ago may not be true today, or vice versa. Yeah. Inshallah.
Another question. You know, when you look at Community Health Choice,
Mhm.
and you look at Blue Cross Blue Shield, because I've heard a lot of people saying, hey, Community Health Choice doesn't pay. Is that true?
Doesn't do what?
Like Community Health Choice, insurance doesn't pay, it's not good. Is that true, Community Health Choice? Or do you feel like, no, all these programs?
They all have to pay. They all need to pay. Community Health Choice is not a very strong company. It's a local company. Sometimes the broker checks also kind of come in late. So I was suspecting them to go under this year, but they have come back. They're in business still. But you know, if you go with a company like a Blue Cross Blue Shield, United Healthcare, I mean, they have deep pockets. Yeah, I mean, you can't go wrong. But this is a local company, and they're trying to survive.
List of your prescriptions.
Yeah.
Some of them that may come or something.
Which tier are you talking about? Different tiers of the prescription.
Yeah, different companies do different things.
Now, you were talking earlier about they cover all prescription. It doesn't matter what tier you're in.
You're talking about Medicare, brother. I'm talking about Obamacare here.
But there's no any prescription.
Prescriptions are taken care of, yeah, but not all medicines are all there. You have to look at your own particular medicine that is covered on that program, and that is something that could be checked under Obamacare as well, also under Medicare. Whoever you're going through, they can check if your particular prescription is covered and at what cost it is covered. Yeah, they can check all that. Jazakallah khair, inshallah. You have a question?
I have a question about
Sure.
dental. So when I moved here, I've heard a lot that dental insurance is not really, even if you do get it, they don't really cover the whole expense. Is that?
No insurance is going to cover you at 100%. There is liability that you take and the liability that the company takes, right? So under dental insurance, typically, it's not covered under Obamacare. You can get it, you have to pay for it. Typically, preventive care is taken care of. Preventive cleaning and this, that, they do it, a periodic dental check, x-ray, they do twice a year, most of the program. If something beyond that, it's a filling or a root canal or something like that, then there is a waiting period. If you've not been with a company long enough, for more than 12 months or 24 months, there's a waiting period. And even after the waiting period is over, they only cover a certain percentage of those procedures, typically 50% of that. And then they have a limit on what is the coverage limit. During the year, some have limits of 1,000. The Blue Cross has programs, pay 1,000. Humana has programs, Cigna has programs, United Healthcare has programs. They start at $1,000 limit per year per person, go up to $1,500, $2,500, and that's the limit. So that's how much they will pay per year. So if you have a lot of holes in your teeth and 2 or 3 root canals that are happening simultaneously, then your dentist can program you based on your insurance policy. See what I'm saying? That way you get the broad coverage. Yeah. Inshallah. Inshallah khair. Assalamu alaikum. Jazakallah khair for listening. No? Yeah. Thank you. Assalamu alaikum. Thank you. Alaikum salam, brother. Sure.
My son, he is 13 years.
Uh-huh.
He has, what you call it, Star Texas already. Can I apply for him for Obama?
Yeah, absolutely. Yeah, absolutely. Yeah.
Because that is limited.
No. Here, everything under Obamacare, all pre-existing conditions are covered. No questions asked. Assalamu alaikum. सही रहा आप पीछे बैठे थे
में तो सब कुछ है
जी
Allahu Akbar, Allahu Akbar.
नहीं
Allahu Akbar, Allahu Akbar. أشهد أن لا إله إلا الله. أشهد أن لا إله إلا الله. أشهد أن محمد رسول الله. أشهد أن محمد رسول الله. هيا على الصلاة. هيا على الصلاة.
حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله